We're really excited to have Sherri with us today to kick off one of our first conversations, but yet a continuing conversation on the role of equity in our work.
Thank you so much, Allison. I really appreciate being here. I'm too excited to be here with you, and I'm going to talk a little bit different, not as much focused on obesity, although I'll give you some examples about early childhood systems, what early childhood system state leaders are doing, thanks to Robert Wood Johnson, while Build has always had an interest and focus on early learning, family support, and early intervention, nutrition, and health. We haven't had always the ability, let me get to that slide, to really focus on health in an intentional way. So we've been doing that and talking to state leaders recently. And then I do want to talk to you about equity, because everybody's got up and spoke, and you talk about numbers, and I think if you racialize the data, if you separate it by race, you're going to see different outcomes. And I really want you to encourage you to think about it in terms of equity and really offer you a frame for doing that. So Bill works with state leaders, as Allison mentioned, around the country, really helping to create the integrated policy. I'm going to give you the end of the speech at the beginning. Please partner. You know, as we talk to these state leaders, we are still working way too much in silos, way too much at different tables. Come to my table over obesity, or I'll come to your table over early learning. We've got one set of kids and one set of communities, and we really need to be thinking about it together. And lots of your states have those tables and those spaces. But as I talk to early leaders, that's what they say. It's like, I don't have any more space for collaboration. And I'm talking about people in health, or people in early learning, or people in mental health. We talk to them all, and they say, look, I'm just out of the bandwidth because of all the funding sources and all of the populations that I have to talk to naturally. And I'm so glad we talked about the workforce, but we're killing them. You know, a training on obesity, a training on literacy, a training on oral language, a training on health and safety. I think that's important, but we got to find a way to integrate it so that they can get those messages. We really are stretching, you know, adults with children and families in sometimes depressed communities without access to fresh foods. I was commissioner in Massachusetts for 4 years, and there was great farm to preschool stuff going on there. But when I went out and talked to others about it, they say, but I don't live near a farm, and I don't have the storage if I'm doing a recreation program in a park to be able to store it. So there's some real issues that we really have to help people work through. I always start with this kiddo because we always think it's so easy, right? But this is a baby in my largest social network. He's about 8 months now. But his mom went to the emergency room one night when she was sick, and she didn't know why she was sick, and she had been out drinking, which speaks to preconception health and working with our young women, that it really doesn't start prenatally. If we really want to do something about infant mortality and obesity and those issues, it starts earlier. I had a call this week with Lauren Smith, who was saying we keep talking about infant mortality as if it starts at birth, but it really starts in preconception, because more and more women have obesity, smoking, and those kind of illnesses that lead to that issue. But his mom went after a night of drinking, felt like she was sick and it wasn't a normal night, to the ER and was told, nope, you're not sick, you're pregnant. They gave her a phone number and they said, go to make an appointment. They gave her an appointment about 9 weeks from the time she was in the ER. Now, I'm also a nurse, and I have a lot of friends in my community, so I made a lot of calls to my doctor friends and my institutional partners and lied about what was going on to try to get her appointment moved up, and it didn't work. Even with the Affordable Care Act, she had to wait that 9 weeks to be able to go in for her first appointment. I did focus groups in Georgia this summer, and pediatricians are still telling moms, don't worry, he's going to walk, don't worry, he's just a little bit at the top of the chart. And so we're still giving mixed messages to our families, and so I'm excited that you're also having that session to talk about families, because they're also so essential. And the other thing our focus group says is we're not speaking the languages of our communities. We can't print things in English and expect our immigrant families, our Hispanic families to be able to read it. We give them all the forms, we give them all the information, and they're sometimes even afraid to come and talk to us because it's not an exchange, it's a one-way conversation in, because they're not able to interpret and understand. And we're telling that in language, speak to the child in your own language, but then they come to us and most of us aren't able to speak their language. I always want to point out that lots of our kids and families are at risk, and they're at risk on multiple angles, and that leads to developmental delay. Bill, working with Charlie Bruner and his group, has done this book on dimensions of diversity in the young population, and it really shows the disparities, which you can begin to see. We're trying to get this slide right, so this is a new version. It's not great. If you look here, this is poverty, and this is non-Hispanic white individuals. This is African American. This is out of 1,000, 427. If you look down here in unsafe neighborhood, you talk about play and going outside, 68. This is self-report of parents out of 1,000 in the white community thought that they were unsafe. 230 African American, 228 Hispanic. And we say part of the prescription is getting more activity and going outside. I'm sure most of you have seen this. The Annie Casey Foundation did a report a couple of years ago and looked at 12 factors linked to literacy in children at 3rd grade. And African Americans, again, are scoring the lowest. So despite all of our big efforts, and we talk about initiatives, they're not impacting our communities at the same rate. I'm not going to leave you with that negative picture. I'm going to give you some ideas about how to move it forward. And this also comes from the IOM report. We must love that report. Because these are all the systems our kids, birth to 8, there's the kids in the middle, these are the people they have to talk to, and then all the rest of us are out here. It's funny, I'm working on an Equity Leaders in Action network for the Build Initiative. We've got 38 people across the country, and we had them put dots on here. Show me where you work and where you think you can make change. And they made the one dot in one place and where the change need to be in another place. We really got to work together so that it's one conversation. This presents a challenge for us and a challenge for our families. So we've been interviewing state leaders around health and obesity. And some of the things that they're talking about are early identification and the capacity to connect families to services. So everybody's worried about identifying something and not being able to connect them to what they need. I think Paul Dworkin talks about it takes 7.5 times of a family reaching out before they really make the connection. We've got to work on that. That's not about early education versus health versus obesity. That's really about all of us. We're talking about medical homes, but you got to pay attention to the quality of the visits. Too many of those visits still are not doing all the assessment they should be doing, let alone we're asking them to do other things in terms of maternal depression, which impacts children's development. Our state leaders are concerned about obesity, nutrition, and physical activity, but we forget that a lot of those centers, parents actually bring the food, because most of your early education and care is still paid for by parents, either in whole or in part. And a lot of times those parents are the ones bringing the food, so the early care providers have less control over what children are eating. I've mentioned infant mortality. You know the social emotional is also a big issue. Access to oral health, which fits with nutrition and health, is also a concern to our state leaders. There are lots of opportunities for us to join together around developmental screening, which a lot is focused on development. There's some people thinking about it around BMI and weight. Title V gives us a great opportunity to come together, but we have to go out and reach out to each other versus feeling like somebody's got to come to the other. Great stuff's going on in hospitals, in communities, not necessarily translating to scale at the state level. We all need to be working to make sure that there's supportive services, that when we identify things for children, families, and communities, we're working on them together. Things like parks are really not a state responsibility, they're a community responsibility. So how are we thinking about working with mayors and first selectmen to get those to be safe spaces? And then there's tools that people are using to work with families to think about growth and development. Policies, when I'm talking to state leaders, these are the things they're saying. There's still a lack of funding overall. I think if we work together on some shared ideas, we'd unloose some funding. There are communities that still have very narrow definitions around Part C, and we need to advocate to extend those. There aren't as many resources going to rural communities as we want. I've talked about languages. There's also policies that just don't align what AAP requires versus what an early childhood program like Head Start might require, and we need to work on that alignment. Data's been mentioned, but people say they just don't have enough data to do the kind of analysis that we want. Here's my latest slide on equity, and it's really trying to demonstrate that for some children to get to the same level, you're going to have to invest a little bit more. That is really uncomfortable for most people, that you've got to invest more in some to get to the same level of result, especially if you're a state leader. And so providing data, providing information that it can make a difference is critical to being able to do it. But if we keep spreading the same services to everybody in the same way, then you still have a lot of children and families that end up being left behind. Here's another way to look at the issue from a movie called Cracking the Code. And Build is doing a lot of work really building relationships. Interpersonal relationships matter, looking at institutions, looking at structural issues which prevent us from dealing with equity and creating opportunity. There's studies done that show that parks in some low-income, diverse neighborhoods are not as safe as parks in other neighborhoods. That's structural. Not having transportation, that's a structural issue. And this comes from a colleague of mine in Ohio. And people say, well, what do we need to work on? What's the most important thing? The thing is, we have to all work on it. And I think a couple speakers have now said you've got to work together because no one of us can do it alone. But if we really want to address these issues around equity and social determinants of health, we've got to work on it all. A mom who's unemployed is going to have food insecurity and therefore housing insecurity. And it doesn't matter what you do in the early childhood program, eventually they're going to leave and have to go to another program or no program at all, which impacts the relationship and the development of the child. So we really do have to be thinking about the physical environment as well as the life course and all the things that impact families. At Build, we tried to have a point of view on this. We want all children to have the opportunity to grow to their full potential. We want equitable resources so that we get excellent outcomes. And we want to provide things that are linguistically and culturally appropriate. We've set it up in these 4 buckets. These are things you can do. People, we must plan the solutions with the people that we are trying to benefit. I mean, too often we sit and come up with ideas and thoughts without taking them back to the group that we're really trying to impact. And they have to have authentic impact in our decision making. This comes out of my colleagues in Georgia. They say, we talk about access and we're happy if it's there, but are people aware? Is it affordable? Can they really get to it? Is it acceptable to them in the way that it's structured? We do have to be willing to put some more resources in different places if we want to get the same outcome. And our institutions have to think about what barriers are in place that prevent individuals from being able to achieve the goals that we want them to achieve. And those institutions need to be culturally competent, really understand the perspective of the families and the communities they serve. And, leaders are important as well. We really need to be developing diverse leaders, having them be at the table, but then find ways that we hold each other responsible for the outcomes that we want as we build our systems. There are examples of programs. You've heard about the quality rating and improvement system. It is a place, if you've got a crisp policy standard idea that is proven to make a difference, to work with states to try to get it integrated. There are people, good to hear about health consultation, but it has to be paid for, and so making sure we have the resources to be able to do that. Mental health consultation, how are we using home visiting as a way to pass messages around obesity? The Early Head Start Child Care Partnerships are a great idea, and a melding of a child care program and Head Start to advance ideas about obesity. You've heard about Farm to Preschool, and it's a great idea. It needs more support in some places to be effective. And so BUILD is also, as I mentioned earlier, part of a learning collaborative, and so we hope to be sharing more lessons with you from specific states and specific communities about how they're integrating these ideas, both about equity and health, on behalf of young children and families. And I like to leave you with this quote that says, if you've come to save me, you're wasting your time, but if you really figured out that somehow your liberation is wrapped up in mine, then let us work together. This really isn't about the other, it's really about all of us. Thank you.